Ms. Jones, I'm glad you're here. We take your health very seriously here at Epic Clinics. And during this unsure time, we're facing the silent menace that is COVID-19. Then the health and well-being of you and your family has never been more important to us. So the steps we take here for hygienic practices in our office, we sanitize our surfaces when we open our office, as well as when we close our office. So 2 times a day we're sanitizing the surfaces that you come in contact with. As you can notice on the table you laid on today, there's also face paper. We change that after each patient, and we make sure to dispose of that properly. All tables are also wiped down before and after each patient, so we want to do our best to eliminate the spread of diseases on the flat surfaces and door handles you come in contact with. So these are the steps we take while you're here to ensure that when you come in, you're healthy, and when you leave, you're just as healthy. Some of the steps that we encourage our patients to take, because as you know, hygiene doesn't just stop and start in this office. It should be a daily, all-day practice for all of us, is washing your hands multiple times a day, especially after using the restroom, before you eat. When it comes to eating, when you're cooking raw meat or things like that, we encourage you to wash utensils afterwards. Make sure you don't cross-contaminate by having them come in contact with other foods you're eating or other things you're touching, surfaces, things like that. Make sure you are cooking your meat to the CDC recommended internal temperature of 165 degrees. And those are just some small steps you can take. If you have a disinfectant in your house, that's a really good idea to have, so you can wipe down surfaces, things like that. You have children running around, so keeping them healthy is really important as well. And that's what we take that seriously here at the office as well, the healthcare field. It's important to have hygiene because of the amount of people we serve, the amount of people that come in. Some people, when they come in, they're not feeling well. And so we encourage people that are experiencing a fever or severe symptoms to just stay home if they can, go to an urgent care. And when they're not suffering from a fever or feeling a little better, to come in and get their care here. And so when children are in the office, we make sure to sanitize the toys before and after use, make sure that the areas that kids are in are clean and taken care of, because as we know, hygiene is not very important to kids. And so ensuring that we take those steps is what's important to us. And at home, we recommend that you do that with your children as well. Make sure that their toys are not coming in contact with their toilets or things like that, just to help keep them a little more safe. But healthcare is the field where we should be able to get well. And if it's not hygienic and not a sanitary environment, then you have no chance to get well. So that's why we do the things we do and why it's important to be hygienic in healthcare. So do you have any questions, Ms. Jones?